There is a silent crisis affecting millions of men around the world, a crisis that almost no one talks about. And the consequences of this silence are destroying the quality of life of our fathers, brothers, grandfathers, and husbands. I'm Dr. Theodore Chambers, and every single man over 50 needs to hear this before it's too late. Today, I'm going to show you 5 simple and natural habits that can protect, restore, and even save your prostate and your sexual health. One of these habits will surprise you, and it could be the most important thing you hear all year. Before we continue, leave me a comment telling me what country you're watching from. Your participation grows this community of brave men who have decided to take control of their health. Your voice matters, and your experience can help another man who's suffering in silence. Look, this is your prostate. It's a walnut-sized gland directly below your bladder that surrounds the urethra. It's responsible for producing the fluid that carries sperm. Until you're about 50, you barely notice it. But from that age on, it often begins to grow. That's called benign prostatic hyperplasia, or simply BPH. It's not cancer, but it can severely affect your quality of life. More than half of men over 50 already have some degree of enlargement, and by age 70, this number rises to over 80% of all men. The symptoms appear slowly: a weak urine stream, difficulty starting, the feeling that your bladder is never really empty, and waking up at night to go to the bathroom. Many men see this as an inevitable part of aging, but modern science shows it doesn't have to be that way. With the right daily habits, it's possible to reduce inflammation, improve urinary flow, and protect the health of your prostate. So let's start with the first habit. It begins with what you eat. What you put on your plate can be one of the most powerful tools you have. The right foods can reduce inflammation, balance your hormones, and even reduce your cancer risk. Let's start with lycopene. You find it in tomatoes, guavas, and watermelon. And here's an important fact. When you cook tomatoes and add a little olive oil, your body can absorb lycopene much better. Studies have shown that men who eat cooked tomatoes at least twice a week have a significantly lower risk of developing prostate cancer. To this, you should add zinc. It's found in pumpkin seeds, shellfish, and nuts, and it helps keep your testosterone levels in balance. And don't forget cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. They contain a compound called sulforaphane that helps the body eliminate toxins that can damage the prostate, thus protecting it. And now a little-known secret: saffron. Studies have shown that the active compounds in this spice can slow the growth of cancer cells and improve the symptoms of an enlarged prostate. Its effect can be as strong as some of the best medications used for this condition. So how do you use it? Simply integrate a generous pinch into your daily routine, approximately 15 to 20 threads, or a quarter teaspoon if it's ground. You can add it to a tea, sprinkle it over salads, mix it in rice, or even stir it into yogurt. With this, you add a powerful ally for the health of your prostate. I met a patient 2 years ago. Let's call him James, a retired accountant, 67 years old, from Chicago. He came to my practice with classic BPH symptoms. He was getting up 4 or 5 times every night to urinate. He was exhausted, frustrated, and his social life had shrunk because he always needed to be near a bathroom. I recommended he start with these foods: cooked tomatoes 3 times a week, a handful of pumpkin seeds every morning, steamed broccoli regularly, and saffron in his afternoon tea. "Doctor," he told me, "I thought only surgery could help me, but I'll try it." 3 months later, James came back. His face had changed. "Dr. Chambers," he said, "now I only get up once a night. Sometimes I sleep through the entire night. My energy has returned, and best of all, I don't feel that constant pressure on my bladder." That's the power of proper nutrition. It's not magic, it's biology. You're giving your body the tools it needs to repair and protect itself. And this is just the first step. Now, if you think eating well is good for your prostate, let me tell you about our second habit. It can transform the health of this gland with just 15 minutes a day. Listen carefully. A large study from the University of São Paulo in Brazil showed that older men who simply walked 15 minutes after lunch or dinner had up to 35% less risk of developing enlarged prostate symptoms. Why does this work? Because walking after eating improves blood circulation in your pelvis, bringing more oxygen and nutrients to this gland. It also helps regulate your glucose or blood sugar levels. This is crucial because insulin resistance and diabetes increase prostate problems, including cancer risk. This habit also improves the health of your entire body by reducing inflammation. How do you do it? Ideally, walk 15 minutes at a light pace after eating. It can be after lunch or dinner, but if that's not possible, do it at another time of day. The important thing is to move more and avoid sitting for hours in the same position. You don't need to run or go to the gym. Just by walking 15 minutes a day, you're already helping to improve the health of your prostate. I remember another patient, Michael, 71 years old, a retired engineer from Boston. Michael was sedentary. He spent most of the day watching television or reading. His urinary symptoms were severe, and his PSA, the prostate marker, was elevated. Michael, I told him, I need you to do one thing for me. After each meal, just 15 minutes of walking. It doesn't matter if it's in your neighborhood, in the park, or even in your house if the weather is bad. Just walk. At first he resisted. Doctor, at my age it's hard to change habits, he said, but I explained the science, showed him the studies, and finally he agreed to try it. 6 weeks later, Michael came into my office walking more upright than I'd seen in months. Dr. Chambers, he said with a smile, my urinary flow has improved. I don't have that desperate urgency anymore, and I feel stronger, more alive. These 15 minutes have become my favorite time of day. That's exactly what I want for you. It's not about big, impossible changes. It's about small, consistent steps that your body can maintain. And when you combine nutrition with movement, the results multiply. Now we come to our third habit. While walking is powerful, this next point is closely related to the first two and has a profound impact on your risk of aggressive prostate cancer. The habit is the daily effort to maintain a healthy weight. Excess body fat, especially the fat around your abdomen, isn't just sitting there. It's an active organ that produces inflammatory substances and disrupts your body's hormonal balance. This is where the danger to the prostate becomes serious. Study after study shows a strong connection between obesity and the risk of developing aggressive and potentially fatal prostate cancer. Being overweight creates a perfect storm for the growth of a more dangerous cancer. For men who are already dealing with BPH, being overweight also worsens urinary symptoms. The solution is to make weight management a priority through the two habits we already discussed: healthy eating and regular physical activity. Even moderate weight loss can have a massive effect, reducing inflammation and lowering your risk. I had a patient named Robert, 64 years old, from Philadelphia. Robert weighed 230 pounds at a height of 5'9". His waist measured 43 inches. He had severe BPH, high blood pressure, and prediabetes. Robert, I told him, your weight isn't just a number on the scale. It's an active risk factor for your prostate and your life. We need to work together on this. I designed a simple plan for him. The foods I mentioned before, walks after each meal, and smaller portions on each plate. Nothing extreme, nothing impossible, just sustainable changes. In 6 months, Robert lost 26 pounds. His waist dropped to 38 inches. But most importantly, his urinary symptoms improved dramatically. His PSA went down, his blood pressure normalized, and Robert told me something I'll never forget. Doctor, he said, you didn't just save my prostate, you gave me back my life. Now I can play with my grandchildren without getting tired. I can sleep through the night. I feel like a new man. That's the power of maintaining a healthy weight. It's not about vanity. It's about survival. It's about quality of life, and every pound you lose is a step toward a healthier prostate. That brings us to our fourth habit, and it's perhaps the most underestimated of all for prostate health. We're talking about getting quality sleep every night. Chronic lack of sleep increases inflammation, disrupts your hormones, and wears down your body. In deep sleep, your body regulates melatonin and growth hormone, which repair tissues and strengthen your immune system. Look at this. A study showed that men who slept less than 7 hours per night had more than double the risk of developing advanced prostate cancer compared to men who slept uninterrupted. In addition, good sleep keeps your testosterone, glucose and blood pressure levels stable, all crucial for good male health. So what can you do? Aim for 7 to 8 hours of sleep per night in a dark, cool and quiet room. Avoid caffeine in the afternoon. Reduce screen time 1 or 2 hours before bed, and try to go to bed at the same time every night, even on weekends. Sleep is not a luxury, it's regenerative medicine. I had a patient named David, 69 years old, from Seattle. David slept only 5 hours per night. He had chronic insomnia, woke up constantly, and was always tired. His PSA levels were rising, his urinary symptoms were worsening, and David was scared. "Doctor," he told me, "I feel like my body is shutting down. I have no energy for anything." I explained the connection between sleep and prostate. I taught him breathing techniques, sleep hygiene, and recommended natural supplements like magnesium and melatonin. I asked him to make sleep an absolute priority. 2 months later, David was transformed. "Now I sleep 7 hours almost every night," he said. "My urinary symptoms have improved. My PSA stabilized. And doctor, I feel alive again. I have energy. My mind is clear." That's the power of sleep. When you sleep well, your whole body works better. Your prostate repairs itself. Your immune system gets stronger, and your disease risk decreases. And now we come to our fifth and final habit. The habit that no one dares to talk about. Pay close attention. If you want to give all the other habits a final boost, this last one is the most unexpected. Many older men overlook it, but believe me, it's one of the most effective methods to clean the prostate naturally and reduce inflammation. A very large Harvard study with over 30,000 men showed that those who did this more than 21 times per month had a 33% lower risk of prostate cancer compared to those who did it less frequently. We're talking about ejaculation. Biologically speaking, this act expels residual fluids, inflammatory proteins and dead cells that, if they accumulate in the prostate, can lead to congestion and irritation. It also improves blood circulation in the pelvis, helps balance hormones and reduces cortisol and stress, all factors related to chronic inflammation. That's why I tell you, it's never too late to take care of your intimate health. And if you have pain, difficulties or low libido, talk to your doctor. He's there to help you, not to judge you. I know this topic is uncomfortable for many, but the reality is that regular ejaculation, whether through sexual relations or masturbation, is a natural cleaning mechanism for your prostate. Think of it like washing your car. If you never wash it, dirt accumulates. The same happens with your prostate. Regular ejaculation keeps it clean, reduces pressure, eliminates potentially harmful substances, and promotes healthy circulation. Today we've gone through 5 powerful habits. We've talked about nourishing your body with prostate protective foods. We've discussed the need for daily movement. We've seen the crucial connection between a healthy weight and your cancer risk. We've covered the regenerative power of sleep. And finally, we've talked about the powerful cleansing benefit of regular ejaculation. I want you to understand that these habits work together. Healthy eating helps you maintain a healthy weight. Daily walks facilitate weight management. And good sleep gives you the energy to do all of this. Your health really is in your hands. You don't have to feel helpless or accept frustrating symptoms as part of age. Every healthy meal, every walk, every conscious decision is a step toward a future with more well-being and more freedom. If you found this information valuable, please give this video a like, so it reaches more men who need this message. Subscribe to the channel for more science-based health tips, and most importantly, share this video with a friend, a brother, or your father. You could change or even save a life. Leave me your country in the comments. Your voice can inspire another man who needs this message. Thank you for your time. Start today. I'm Dr. Theodore Chambers, and your prostate health begins with these 5 daily habits. See you soon.